Well, as you point out, Gateway is about people. It's about giving people the opportunity, the expertise, and the reason to have the favorite word in our vocabulary, hope. Every person who takes part in a Gateway-funded clinical trial has a story. Of the thousands of incredible stories that underscore the importance of investing in cancer research, we're going to share 3 amazing stories with you this evening. Each are in different stages of their unique and individual cancer journeys. These patients represent stories of healing, stories of hope, and most of all, stories of survivorship. You'll hear about Gordon Kent Thomas, a man who, thank you to a Gateway-funded clinical trial, is home with his wife, enjoying the life they built together, and enjoying their time with their family. Kent's story is a story of healing. You'll hear about 8-year-old Luke, who at the age of 4 was diagnosed with an inoperable brain tumor. When traditional chemotherapy failed him, he was enrolled in a Gateway-funded drug trial, and in only 12 weeks, Luke's tumor shrunk by more than 50%.
Yay.
Thank you.
Yay. Yay.
Luke is still fighting, and he's doing what he loves in the process. He's back to playing baseball, going to school, and surely giving his brothers a run for their money. Luke's story is a story of hope. And then you're going to hear about Maddie. Many of you know Maddie. She's a vivacious 22-year-old woman who just reached an incredible milestone. Let's hear it for Maddie, because I know a lot of you know her. And here's why we need to give her extra applause, because she just reached her 5-year survivor cancer anniversary after her courageous battle against osteosarcoma and the benefactor of a Gateway-funded trial. Her trial actually was aimed at optimizing liver function and preserving her hearing, because these were 2 areas that were adversely affected by the life-saving treatment. Not only is Maddie thriving, you're going to love this one, she's paying it forward. She's working as a cardiac ICU nurse, and without question, she's making an impact in the lives of others and giving her service back. Thank you, Maddie. We love Maddie's story for her survivorship. But none of these stories would be possible without the collective involvement, support, and contributions of you and so many others. As Michael said earlier, Gateway doesn't work alone. We partner with leaders, visionaries, and amazing humanitarians around the world to change the face of cancer in every single corner of this world. We are fortunate to support and be supported by organizations that not only see the opportunity behind every obstacle, but embrace the opportunity to empower others. This includes healthcare and many other aspects of humanity, inclusive of education, safety, and basic human rights on a massive global level. I'm sure you all agree with me that promoting the welfare of others is an honor. Thank you. Seeing it as such and answering the call to help is a virtue that's truly worthy of recognition. There is no question why we're all here this evening. We're here to be the gateway to transformational, patient-centered clinical cancer trials. That is why we are here. Thank you. Saving lives with trials. Trials that give patients hope, more time, and the best possible chance at conquering cancer when? When do you want to conquer cancer, honey? Today. Today, not tomorrow, not last week, but today. When we do our part on a philanthropic level, Gateway for Cancer Research can do the vitally important work that makes a difference for those facing a cancer diagnosis. As a physician, I can say with certainty that Gateway is in a league of its own when it comes to cancer research. To our knowledge, we are the only nonprofit organization that exclusively funds early-stage phase 1 and phase 2 clinical trials. And these trials plant the seeds and pioneer the science that leads to potentially groundbreaking therapies. Thank you. We are the only at the 99 cents on every dollar in clinical phase 1 and phase 2. These trials are trials that may otherwise go unfunded and unnoticed. And while Gateway works to end cancer as we know it by funding groundbreaking drug studies, we're simultaneously pioneering innovative, holistic approaches to treat the whole person, mind, body, and spirit. Gateway advances precious, evidence-based clinical research, including integrative therapies, which makes us ever the more unusual. And we do all this work in partnership with renowned cancer care institutions around the world because we want to share the information. No matter what that information is, we're going to share it and bring it forth because that's why we do what we do. From those right here in Chicago, like Northwestern, Loyola, Lurie Children's, to the University of Texas MD Anderson Cancer Center, Memorial Sloan Kettering Cancer Center, the Cleveland Clinic, and Tel Aviv University. For Gateway, it's about advancing compassionate, patient-centered clinical studies to give patients more comfort, more hope, more time. Thank you. It's all about more time. Gateway's impact is driven by the clarity of this very vision, yours, my dear, your vision, creating a world in which a cancer diagnosis is no longer feared. When you delve into the statistics behind the cancer, you realize just how bold of an objective this truly is. It's a big objective. Because this year, 1.7 million people will be diagnosed with cancer in just the U.S. alone. Just over 600,000 of those individuals won't survive. Their lives cut short, their families forever changed. Their incredible impact on the world lost. Gateway funds trials that are centered on what matters most, only and always about our patients. Period. End of story. Amen, my friend. This gentleman pioneered that. And you're unyielding, honey. You are unyielding in that vision. Changing the face of cancer care, changing what a cancer diagnosis means is what brings us all together this evening. That's why we're here. It's about giving patients and families facing cancer a gateway of hope.